During a normal sinus rhythm, electrical impulses are initiated by the SA node. These impulses move through the atria, pause at the AV node, and then continue through to the ventricles. This pause at the AV node creates a PR interval of 0.12 to 0.20. In the case of a first-degree block, the electrical impulse follows the same electrical pathway, but the pause at the AV node is longer than normal. This longer pause results in a PR interval which is greater than 0.20. When looking to interpret this rhythm, the first thing we always look at is the regularity, and this will be a regular rhythm. Next, we're going to look to our P waves, and we'll find normal-looking P waves, and we will find one P wave for every QRS complex. However, once we start measuring, we'll note that our PR interval is greater than 0.20. Finally, moving on to our ventricular activity, we'll note that the QRS complexes look narrow, they look fine. So here with a regular rhythm, normal looking P waves and normal looking QRS complexes, but with a greater than 0.20 PR interval, means we will have a first degree heart block. Now, there may or may not be any special significance to a patient with this rhythm. They may be asymptomatic and they might not need any special treatment. However, we should keep in mind that there's a possibility that this first degree block may progress to a second or third degree block, which is much more likely to require some sort of intervention. So to review, first thing we're going to do is check for regularity. A first degree block will be a regular rhythm. Second, we move on to our P waves. They're going to look fine, and we're going to have one P wave for every QRS complex. However, your PR interval will be greater than 0.20. Finally, we're going to look at our QRS complexes, which will be narrow. They're likely to look normal just fine. So that'll leave us with a first degree heart block.